Hey class, today we're going to start our almost second to last chapter. They're very short chapters. They're the respiratory and digestive systems. We're not going to cover them in too much detail because they don't go nearly in as depth as the other videos, but let's go ahead and get started. Okay, so what is the respiratory system? Well, it provides oxygen to the body and it gets rid of the carbon dioxide that we make from cellular respiration, and it helps regulate the blood's pH or its acid-base level. We don't want it too acidic or too basic. How? Well, gas exchange occurs in little tiny air sacs of the lungs known as alveoli, and they use capillary beds to help switch the oxygen to the bloodstream to be transported around the body. Why? Well, without oxygen, cells are going to eventually die. And if you actually build up too much carbon dioxide in your blood, this is going to cause your blood pH to become super acidic, and it actually interferes with a lot of cellular functions that your body needs to accomplish in order to be healthy. So let's kind of list a couple organs that are found in the respiratory system. It consists of your nose, your pharynx, your larynx, your trachea, your bronchi, and your lungs, which at the end have little sacs called alveoli. We're going to talk about each one of these a little bit more detail, but let's kind of give a brief overview of the respiratory system using these words. Well, if we talk about the functional anatomy of the respiratory system, gas exchange occurs between the blood and the external environment at the alveoli of the lungs. This is where blood from the outside gets breathed in and transferred to your blood to go to the rest of your body. Now, your upper respiratory tract, this is just passageways to get from the outside air to your lungs. So this is passageways from your nose all the way down to your larynx, which we're going to learn is known as your voice box. Your lower respiratory tract includes passageways that take you all the way from your trachea down to your alveoli. And these passageways, both of them, help purify, humidify, and warm the air that's coming into your body. Because you don't want the air to be super cold and throw your body into shock. You also don't want your air that you're breathing in to have a bunch of dust and pollen and things that could be unhealthy for you. So here's kind of like a brief overview of the major organs in relation to where they're located. You have your nasal cavity, so you have your nose. You have your mouth oral cavity right below it. But down here, your throat, where you swallow, that's your pharynx. It goes into your larynx, which is your voice box. Your trachea, another word for it, is your windpipe, which then splits into your two bronchi. And then that leads into your lungs, where gas exchange is going to happen. So some basic anatomy of your upper respiratory tract. This is a sagittal section. So it labels a bunch of stuff. A couple things that I really want to hit on first, because I'm going to keep bringing this picture up, is we are going to specifically talk about this nasal cavity. So we're going to specifically talk about the nasal conchae, our little ridges here. We're going to talk about your nostril, where you breathe in at. We're also going to talk about your hard palate, which is a bone that separates your nasal cavity from your oral cavity. We also have your soft palate and your tongue. And then we're going to talk about a couple other things that lead into your throat, such as your nasopharynx, your oropharynx, and your laryngeal pharynx. So let's just go ahead and kind of get started. So the nose is the only external visible feature that we see of our respiratory system. Obviously, when you look at it, you can see your nostrils, also known as nares, and this is the route in which air enters through your nose. Once it gets inside your nose, the interior is called the nasal cavity. And here you're going to find several different structures that we'll talk about in the next few slides. Also, a very prominent feature of your nose is your nasal septum, which helps divide your nasal cavity. So remember, septum helps divide things, like your septum of your heart separated your left and your right side. If we go into a little bit more detail about the nose, it has olfactory receptors. So olfactory are going to be for smell. Wow, I did not write that right. There we go. And these are going to be located in the mucus of your superior surface. Now, the rest of the cavity is still going to be lined with mucus. It just doesn't cover it in olfactory receptors. In fact, this mucus actually rests on a rich network of thin-walled veins. And what happens is those veins that carry blood serve very important functions, such as moistening air. It helps trap incoming foreign particles in that mucus. And that mucus also has enzymes to help destroy bacteria that could be potentially harmful for your body. Now, these ciliated cells are also found within your nose, and what happens is cilia wave, they gently move, and they move in a fashion to help take that mucus that has trapped bacteria, and it causes you to either swallow it, so it goes down to your stomach, or it causes you to cough it up, so that way you are not taking it down to your lungs. Unfortunately, in the winter, your cilia actually become pretty sluggish, which is why you most often usually get a cold in the winter, because your body isn't as effective as getting rid of those foreign particles as they are when it's warmer. Now, your nose also has some conchae, or otherwise known as projections, and these projections are very, very helpful in helping trap these particles. The way they do this is they help increase your surface area. So when air is blowing through your nose, it creates an air turbulence, and it causes foreign particles to kind of bounce off things and hopefully gets trapped in that mucus that's located in your nose. Other structures in your nose include your palate. This helps separate your nasal cavity from your oral cavity, so hopefully you remember oral means mouth. Your hard palate is your anterior or your front side, so I'd say towards your front. This is supported by bone. If you actually took your finger and hit the top of the roof of your mouth, you can feel it's pretty hard from that bone, and that's your hard palate. Then you have your soft palate, and this is your posterior part. It's unsupported, it's very soft, it's very mushy, but it still helps separate. And the last thing we're going to talk about in terms of your nose is your paranasal sinuses. Paranasal sinuses were talked about when we were talking about the features within the skull, because there are 4 major cranial bones or facial bones that actually have nasal cavities where these sinuses happen. These are your frontal bone, your sphenoid bone, your ethmoid bone, and your maxillary bone. So hopefully you remember your maxillary is your upper part of your mouth. And the whole function of these sinuses is to lighten the skull, helps provide a chamber to help us speak and project our speech, and it produces mucus which drains into our nasal cavity. And you probably see this a lot, especially if you are prone to sinuses where you have a lot of drainage. You can feel it going down the back of your throat where your nose is. You kind of get a stuffy nose as well. With everything, there are also homeostatic imbalances associated with the sinuses and your nose. One of the most common ones is a genetic defect called a cleft palate. This is where the bones that separate your nasal cavity and your oral cavity don't necessarily fuse well, and this can cause issues with breathing, speaking, and eating, specifically in an infant who is trying to suckle on their mother's breast in order to get milk. You have rhinitis, which is inflammation of your nasal mucosa. If you ever hear the word rhine, it usually has to do with your nasal area. And this is just nasal congestion, and usually you have a runny nose, also known as a postnasal drip. You have sinusitis, sinus inflammation, and that can actually lead to a sinus headache, where those passageways have been blocked by mucus or other infectious matter, and it kind of causes a lot of pressure in your head, and you develop that headache. So here we brought this picture back up just so you can see those things I was talking about. Here's your conchae. They kind of ridge out to help increase surface area. Again, we have our nostril, we have our hard palate, which you hope that fuses. These are separated completely. Here you have a sphenoidal sinus. Here we have a frontal sinus up here that can be shown. If we want to go on, we can talk about the pharynx. Now, this is commonly called your throat. This is the passageway that food and air take to get to where they needed to go, their final destination. This is a muscular passageway from your nose down to your larynx. So your larynx, again, we're going to talk about here coming up, that's your voice box. Now, there are 3 regions of your pharynx or 3 regions of your throat, and they're named based on where they're located. A nasopharynx, again, naso, is going to be behind your nasal cavity or your nose. Your oral pharynx, oro meaning mouth, this is going to be located behind your mouth. This is your middle region. And a laryngeal pharynx, again, this is going to be located near your larynx, and it's your inferior region or your bottom layer. Now, in terms of your pharynx, your oropharynx and laryngopharynx serve as common passageways to air and food, and eventually they're going to hit this opening called the epiglottis, which helps route food to the posterior tube, down your esophagus, and make sure that air goes down your trachea, your windpipe, down to your lungs. Now, there are also some things called pharyngotympanic tubes that open into your nasopharynx that helps drain your middle ear. So you have ear drainage, can also be associated with having a sore throat, and that's a common thing they look for when you get ear infections. Here are the 3 different regions of your pharynx. Your nasopharynx, again, located behind your nose, oropharynx behind your mouth, and then laryngeal pharynx by your voice box. A couple other things with your pharynx is we also have tonsils. You've probably heard of having strep throat again, and if you get it a lot, they remove your tonsils. Well, tonsils, what they are clusters of lymphatic tissue, and they actually play a role of protecting the body from infection. So whenever you get something like strep throat, it's because it's trying to fight an infection. Now, you have more than just a few tonsils. You actually have several. You have your pharyngeal tonsils, also known as your adenoid. This is just one single tonsil, and it's located in your nasopharynx. You can see it in the back, or it's located in the back of your nose. You have your palatine tonsils, and these are located in your oropharynx in the back of your throat. At the end of your soft palate. These are usually the most common ones people can see. And then you have your lingual tonsils, which are found at the base of the tongue. So if we were going to talk about tonsils, here we have your palatine tonsils. These are the ones that most people often see when you're like open wide. You have your lingual tonsils, and then here you have your pharyngeal tonsils that help fight disease. And the one of the few last things we're going to talk about is your larynx. This is known as your voice box. It plays a role in speech, but it also helps route air and food to the proper channels that it needs to go. It's located inferior to your pharynx, so below your basically your throat. And your voice box is made up of 8 rigid hyaline cartilage, and it has a spoon-shaped flap of elastic cartilage called the epiglottis that helps play that function in routing air and food where it needs to go. The larynx is also the spot where most prominent on males there is a thyroid cartilage, which is your largest of your hyaline cartilage, and oftentimes they call that your Adam's apple that bobs up and down as you talk, since the larynx does play a role in speech. Now, we mentioned the epiglottis, so why not go ahead and talk about it? We already said that it is a spoon-shaped flap of elastic cartilage, and what it does is it helps protect the opening of your larynx. So when you're breathing, it makes sure that your food is going down your esophagus, and air is actually going down your trachea to your lungs. And when you're swallowing, your epiglottis moves, it rises, so that where your larynx is covered and food doesn't go down your windpipe, it actually goes to its appropriate channel. If anything does end up entering your airway, your larynx has something called a cough reflex, and that gets triggered, that makes you cough and try to hack up whatever is going down the wrong pipe. Now, this cough reflex does not work when you're unconscious, which is why they say if somebody's unconscious, don't feed them, don't give them something to drink, because this is not going to work and they could potentially choke on their own food. Within the larynx, there's also something called vocal folds. This is your true vocal cords. This vibrates with expelled air. It's one of the things that allows us to speak. And then we have the glottis, which is our actual opening where our vocal cords are located. So if we were going to look at this picture and figure out where your larynx is, it's over here. It's bolded. Here's your epiglottis. Here's your thyroid cartilage. Here, and here's your vocal folds right here. The last thing we're going to talk about before I kind of head this off is your trachea. This is also known as your windpipe. So once you make it through that voice box, things are going to start going down to your lungs. This trachea has very rigid walls that are reinforced with C-shaped rings of hyaline cartilage, and we want these walls to be very rigid. We don't want them to be able to be squashed or pushed down or cut off because air and oxygen is very important for our body. This actually allows your esophagus next to it to expand when swallowing a large piece of food without actually cutting off your wind or your oxygen source. This also helps keep your trachea patent or open so it's not crushing by the pressure. Now your trachea is lined with ciliated mucosa. It has mucus and cilia continuously trying to trap any debris that's trying to get down into your throat, like dust, bacteria, any potential harm. And it helps beat in the opposite direction of incoming air, so it tries to make you spit it out. So here we have a picture of our trachea and our esophagus. And then here is an up-close kind of picture of the cilia within the lung, or the trachea. And then I know I keep saying it's the last one, but this really one is, we have something called the main bronchi, and this forms by the division of the trachea. Your trachea is actually going to split into the right and left half, and these right and left are called the main bronchi or bronchus that head into the lungs. Now, one fun fact is your right bronchus is wider, shorter, and straighter than the left, which has its downfall because that's where usually a lot of things do get lodged and stuck. And these bronchi are going to further subdivide when they get into your lungs into smaller and smaller branches until they get to the small bronchioles. So over here, I'm just going to give over here the main thing. You got your nose, nostril, you got your oral cavity, you got your pharynx, your voice box, your larynx, and your windpipe, your trachea. And then when it splits down here, you have your right and left bronchus. So that's all that I'm going to cover today. Let me know if you have any questions, and I'll be more than happy to help. Have a good day.